Thank you, everyone who has joined, and I'm sure we'll have more people join. So, just to give a brief overview, why are we talking about measles? We thought we had eradicated measles. Unfortunately, in 2024, we seem to have a resurgence of measles around the world. So, all over the world, there's an increase of cases. And then, unfortunately, here in the US as well, we've seen more cases come in from international travelers. And we've also seen some local cases in Arizona and even as close as Flagstaff. So we, as a healthcare facility, want to make sure that our community is aware of measles and up to date on what we are paying attention to. So I'm going to share my screen. Dr. Hu will start.
So we're talking about measles because some of you have been probably reading the newspapers, and it's been you've been noticing that measles cases have risen in the U.S. in the past year. And we thought we were all done with all these pandemics, right? The germs are smarter than we are. They always are. And at least as of last week, there are over 60 cases of measles in the whole U.S., which sounds like nothing, I know, but it's highly contagious, and it's imported, and it's affecting people that are unvaccinated. And so we want to try and make sure everybody understands why we are so concerned, because it's super contagious, and that it is preventable with vaccines, and that you're aware if somebody in your family who's unvaccinated comes in with symptoms of measles, that there are certain things that we need to do to protect the rest of the community and your family and that person. So this is the more technical stuff for those of you that are into nerd stuff. Measles is an RNA virus, so it's different than COVID. It's different. I mean, it's in a different class of viruses than COVID and flu and a bunch of other stuff. It's very unique. We are the only hosts. Humans are the only ones that get measles. People used to say that distemper was a kind of like doggy measles, but it's not exactly the same thing. It's by airborne transmission, which means it stays suspended in the air for up to 2 hours, and it lives on surfaces for up to 2 hours. And it's highly contagious. It's probably one of the most contagious viruses. Each new case will infect 12 to 18 unvaccinated people. That's called the R naught. And we know for COVID, that's not even close, okay? We know for flu, it's probably maybe 3 to 5. So before measles vaccination, pretty much everybody who was a child got measles. Unfortunately, some people got very severe measles, and measles can be fatal. And so we want to try and prevent it as much as possible. It is most infectious for 4 days prior to the onset of the rash and 4 days after the onset of the rash. And so the hard part is, just like many viruses, which are super smart, they are most contagious before you even know you have them, which is a bummer. But there are some other symptoms that you get prior to the onset of the rash. And the incubation is 7 to 21 days. And so why is this important? Because if you get exposed, you may not show up with this rash and know you have measles until 1 to 3 weeks later. And by then you've been cavorting around the world, and you've been going to different places. And for example, the 2 cases in Maricopa County went to 7 different places. And the 2 cases in Coconino County went to, I think, 6 different places, including the ER and Flagstaff Medical Center twice, and an urgent care center, exposing probably over 200 people theoretically. Bummer, right? Next slide. So you can see with the 7 to 21 day incubation, the first day that you actually get sick, which is sometimes in that 7 to 21 days after you've been exposed, you get a high temp. So the temp is usually at least 101 and can be as high as 105. The kids that I've seen that had it, in 1991, those of you that are ancient fossils like me, we had 200 cases of measles on the reservation. That was a big bummer. And so I'm one of the few people that has actually seen measles in person. They do not look happy. They look miserable. They have a fever, they have cough, they have runny nose. Coryza means like super runny nose. They have conjunctivitis, meaning their eyes are red and watery. They can sometimes have these little white spots in their mouths, which are very different than herpes cold sores. They're very different than hand, foot, and mouth. They're just little kind of white spots, and we'll show you a picture of that in a second. But the most classic thing is to get this thing called the morbilliform rash, and morbilliform means measles-like. So it's kind of cool that they named it after the actual disease. But it starts on the face, it starts sometimes on the hairline of the neck, and it spreads downward onto the trunk and then down to the arms and legs or the extremities. It blanches usually, but sometimes it can actually even get purplish and not blanch. There'll be little purple dots when they get very severe measles. And they don't look happy. These are not happy, sneezy kids. These are miserable looking kids. They also sometimes have ear infections, and they often have diarrhea. And this is a picture taken from a book. people with measles. So this rash is very characteristic because it's actually, you can see how much of it there is. It's all over this poor kid's face, and it's now on his back as well. You can see he doesn't look like a happy camper. He looks really miserable. And even in kids who are not white, it can be bright and red like that. Those white spots on the side are the Koplik spots. You can see those don't really look like the ulcers that you see from having a cold sore or the ulcers that you see from having hand, foot, and mouth. They're little tiny white spots, and those are less likely to be seen than the rash. I mean, the rash is very hallmark and characteristic. So in medical school, we're taught that measles is the 4 C's, which is sort of a joke because it's cough, coryza, which is a fancy word for runny nose, conjunctivitis, which is, red eyes, and Koplik spots, which is spelled with a K, but we always say it's with a C so that you can remember, it's easier to remember that way. And then once again, fever and this rash. However, so most kids who got measles did fine. Now, a lot of kids would, I don't know if anybody who's on this call remembers having measles. They often don't want to look at the light, and they're miserable, and they have a headache, and they feel nasty, and then they get better. However, unfortunately, 1 out of 20 infected children used to get pneumonia. They used to get lung infections. They have low oxygen, increased work of breathing, and they have to be coming to the hospital. And usually they get better, but it can take weeks for them to get better. The really severe complications of measles, you can get brain inflammation, and that happens in 1 out of 1,000 infected children. And that can lead to permanent deafness or intellectual disability. And the kids are very sick. They have the worst headache of their lives, and they need to be hospitalized as well. 1 to 3 out of 1,000 infected children used to die before we had measles vaccine. That's horrible. I mean, that's just unacceptable, right? And obviously now we have more people that are immunocompromised because of our different medications that we have. And if people who are pregnant or unimmunized, they are at higher risk of getting measles, and that can be severe both for the mother and for the fetus. The overall hospitalization rate used to be 1 out of 5 infected people with measles. It now is, fortunately, it's not that high anymore because we don't have that many cases, but it's very contagious once again. And that's why in the hospital, we have to be very careful about if we suspect someone with measles, we isolate them immediately so they don't spread it to other people that are at high risk. And once again, you see these things at the bottom show that there's this one other weird thing called SSPE, which stands for subacute sclerosing panencephalitis. It's a very bad kind of almost an autoimmune kind of reaction to having had measles. It's extremely rare, but it's also fatal, which is horrible. And so all of these things can be prevented with vaccination. The measles vaccine was actually first introduced in 1963. It was one of the first live virus vaccines. And it has been around, as you can see, for decades, and it is one of the best vaccines we have. It is highly effective. It is 93% protective for life after 1 vaccination. And the interesting thing is that the second vaccination that most people get, so once again, kids get it at 1 year of age, and they get it again at 4 to 6 years of age before they go to school. It's not that we're trying to boost them, although it does boost their immunity, but in this one, the 7% that didn't react to the first vaccine, of those 7%, 93% of them will now react to the second vaccine. So now we've got like 97% protection, which is pretty cool because we know that measles is so contagious that we need to have about 90% immunization to really prevent transmission in a community. In 2000, they thought measles was gone from the US because we had such high vaccination rates. They had not reported any cases from people who actually lived in the United States. However, there have been cases of measles that have come that have been imported from people who are unvaccinated. There was a very famous situation in around 2001 where a family from Italy who was unvaccinated went to Disneyland. Now, I've already told you how contagious it is. So once again, you go to Disneyland with those thousands of people and you stand in those lines for hours and hours and you cough and sneeze on them. Yes, they had several cases of measles in unvaccinated people that were imported from another country, and then they came to the US and spread within the US. Once again, 10% of cases can still occur in vaccinated persons in the past 3 years, but they had milder disease and they were much more difficult to diagnose. The majority of cases, 90%, were in unvaccinated people, either children under the age of 1 year who were not eligible for vaccination or people who had declined to be vaccinated.
All right. So these graphs are looking a little bit at measles cases over the past, and so in the top left graph is the past 2 decades, so since early 2010 or so. So you can see that in most years, and especially recently, the very lowest year is 2020, which was COVID, and thankfully we didn't have many other viruses. But the past 4 years since then, we've had very, very low rates of measles. So in 2014 and 2019 were bigger years. One of those was the Disneyland year, but the bottom right graph shows the number of cases since the beginning of 2023 up until current. And so in the past 2 months, we've had many, many more measles cases, and this is why we're having this conversation, because there are more measles cases internationally, and thus there are more measles cases that have been introduced into the US and then resulted in local spread in the United States. So as of March 21st, the most recent data, there have been 64 cases reported in the US in 2024. And this is alarming because this is as many as there usually are in a whole year. So in the first 3 months, we've already had as many cases as we've had in many full 12-month periods, which is why we're on high alert, making sure that we educate the community and make sure everyone who is eligible to be vaccinated can get vaccinated. So how do we diagnose and treat measles? So a lot of it is clinical. So Dr. Hu described the presentation and what patients look like. We know there likely were exposure to measles in Flagstaff. So we've made sure that all of our medical staff are aware and have high alert to keep that in the differential for anyone that comes in with a fever and a rash. Technically, if somebody were to present and have concern for measles, we would do a nasal swab, sort of like a COVID swab, and take a blood sample. And that is only run in the Arizona State Lab. So it's a send-out test that takes 2 to 5 days to come back. And we'll talk about what needs to happen in that time frame in terms of isolation. And then treatment, we don't have any treatment. So as a vaccine, it's not responsive to antibiotics, and really it's supportive care only, just giving the body time to respond to the virus. So isolation is a term, unfortunately, we're all quite familiar with after the COVID pandemic, but because measles is so infectious, we need patients who either have measles or likely have measles to isolate because we do not want them to spread this virus to many other people that could be susceptible to measles. So we obviously don't know before the rash appears they have measles, but once we recognize that they have measles until 4 days after the rash started, those patients need to be in isolation. It also affects school attendance. So if there are children that are in school and there's a measles case, anyone who does not have the measles vaccine would be advised to stay home for 21 days after an exposure, because again, they are very, very susceptible or likely potentially to get measles. So another reason to make sure the measles vaccine is up to date, so kids can stay in school. We don't want to miss any more school. So in terms of our epi and prevention, so hopefully we do not see any measles cases this year. So far, we are close to the end of the 21 days time zone from when the second patient in Flagstaff exposed people in various public places. But if we were to find somebody with measles, the health department would obtain a very detailed travel history. So in those 4 days before the rash and 4 days after it started, we would find out exactly where they've been. So every store they walked into, every restaurant, anywhere they went in public where they could have exposed other people. And even if they were only in there for 5 minutes, because it is airborne, as Dr. Hu described, those infectious particles can stay in the air for 2 hours after that person left. And so you'll see that those information are posted so that anyone who may have been exposed is aware. We would then make sure that any close contacts are vaccinated. So ideally, people are already vaccinated and thus at much lower risk. But we can vaccinate people even up to 3 days after they were exposed, if they are not sure if they get a vaccine or if they know they didn't get a vaccine but now are willing to get one. There's also something called a measles immunoglobulin that can be given to people that are not vaccinated. They decline the vaccine but are willing to get this medication that can help prevent the virus from causing infection. And then we isolate and monitor all contacts for 21 days because in those first 3 weeks after an exposure is when they potentially could develop symptoms of measles and start shedding the virus themselves. So hopefully we don't see any cases, but this would be the plan if we do. So how does this affect your family? What's important here? So really, the most important thing is to make sure that your family has all their measles vaccines. So we've used the word MMR. Measles vaccine comes with measles, mumps, and rubella in one vaccine. As we mentioned, these vaccines are given routinely at the 12-month or the 1-year-old visit and at the 4-year-old visit. So as long as people come in for routine childcare, they should have received these vaccines and be vaccinated. If there is an older person, we've had actually many calls since we've started posting information about measles in our nearby communities. But if there is an adult that was born in Tuba City area, they most likely were vaccinated as a child or during the 1991 measles outbreak that Dr. Hu referred to. If somebody was born elsewhere, ideally we'd find their records and hopefully confirm that they have the measles vaccine. We can also potentially check for titers to see if they have evidence of vaccination before, but thankfully most adults in our community have all received that vaccine. And then another really important point is, so if your child or somebody that you are aware of has a fever and rash, we want to know about it, ideally before you show up at the clinic. So please don't walk into the waiting room and wait there for 30 minutes and then tell us that they have a fever and rash, because that would result in exposure to many more people that are in that public space. So for example, if you're coming to pediatric clinic, please call. Let the scheduler know that your child has a fever and rash. Potentially if there's any travel related, then let us know beforehand, and we will make sure to either potentially see the patient in the car and do an exam, or quickly get them into an exam room without exposing everyone in the waiting room. The same is true for the emergency room. Call ahead and notify if possible, or immediately on check-in, let them know. Please mask if possible. I know some could be a young child, in which case masking will be hard. And similarly, they will try to immediately get the patient into the room or have somebody wait in the car until there's a room available. So these are the things that we're asking of the community. Make sure you have your vaccines, and make sure if there's any concern for measles, please let us know beforehand, before you arrive if possible. All right, so that is the overview on measles, both the clinical presentation, the vaccines, the epidemiology, or the numbers of cases that we're seeing across the country. And so we are happy to pause and take any questions. You can write them in the chat, and we will do our best to answer them.
The one thing I just want to comment on that it's part of our world these days is everybody travels everywhere, right? And so once again, these are usually people that are unvaccinated. We know that there are a lot of measles cases right now in Chicago because there was some measles spread in a migrant shelter there. There also were many cases in New York because there's a lot of international travelers that go through New York. But, Phoenix is now the 4th biggest city in the nation, and it has a very large airport. And the 4 cases of measles in the state of Arizona are all linked to an international traveler that went to Phoenix, traveled to Phoenix, went to a couple places, exposed a bunch of people. And fortunately, only 4 people got it. But we still have to kind of stay on alert. As long as there are cases occurring in the United States, they could come to Phoenix, and we could go to Phoenix, and we could be next to them, at a restaurant in the airport or something like that. So we do have to be aware that this is not something that's totally gone, even if we exceeded the 21 days of incubation from the cases from Flagstaff.
So there is a question in the chat. How exactly does the virus spread?
You breathe it in. So the way it spreads is if I have measles, I'm breathing it in and out, and it sits in the air above me, and then I leave. And then you come in the room and you sit down in that same chair and you breathe it, and it goes into your body and replicates. If you're vaccinated, your body goes, wait a second, you're not supposed to get sick with this, and it will kill the virus. If you're not vaccinated, however, your body will go, oh, what is this foreign invader? I have no idea. And he is so good at replicating, then you get infected. And then basically about 7 days later, you've replicated enough virus to all of a sudden, oh, you feel achy, and you have a fever, and then you get a runny nose, and you get a cough, and then you cough those germs into the air, and then the next person walks in, and that's how it spread. Does that make sense? I hope.
Yeah, so the next question is, can droplets on clothing transfer? Should we change our clothes? So I think measles can also technically spread by contact, or sort of touching something and then touching your mouth or your nose. I think in general, as long as you are vaccinated, I don't think we need to be super anxious. I really don't want to go back to the early COVID days where we were wiping down our groceries and, obsessing over changing clothes and things like that. So as long as you have your vaccines and you use reasonable hand hygiene, washing before you eat, I think that is very reasonable. But yes, technically it can be spread from touching something and then touching your mouth or your nose.
But the major way it's spread is by breathing it in. for the infectious particles that are in the air. So, as you know, here in the hospital, we are still masking. And so, you could think about, well, if I was flying to Chicago on a flight to Chicago, I probably would be wearing a mask because I don't know who in Chicago has been around somebody else who has measles. And Chicago has transmission of measles right now, okay? But probably around here, if you want to be cautious, if you're not vaccinated against measles, you should think about maybe wearing a mask until we're really sure that this is all gone. But if you are vaccinated, you're pretty safe.
Next question is, do you recommend for us to keep wearing our mask? So the doctor who just alluded to this, I think as long as you're vaccinated, I think, it's fair. If you're in an emergency room waiting room, I think it's reasonable to wear a mask, or if you're on a plane with a bunch of people. But I don't think for the most part, this is something that we need to super panic over. We're being cautious because we do not want to have massive spread, especially among our unvaccinated young children or any of our immunocompromised patients. But for the most part, this is not at all the same kind of panic from early in the COVID pandemic.
And once again, we've audited for teenagers, so you're required to have 2 measles vaccinations to go to public school here as well. And the BIU usually follows the state vaccination rules. And we have very few people that decline their MMR vaccine in our community. So our community is relatively safe compared to other communities that have lower vaccination rates. Or pockets. So for example, in New York, one of the big pockets was unimmunized people that were declining all vaccinations on a religious basis. In this migrant shelter, once again, they didn't have vaccination records. They have all come from different parts of the world. That's why they were probably more susceptible. So once again, if you are concerned that somehow you have not been vaccinated against measles, you can come and give us a call to the public health department, or to just call the clinic, and we can actually look up your records. We do know, like I said, probably for the past 20 years, we've had excellent vaccination rates through young adulthood. Those of you that are older, like me, if you're born before 1957, you probably didn't need to be vaccinated because you were exposed to natural measles. You may not have gotten it, but you were definitely exposed to natural measles. After 1957, there may be a little block of people that are maybe 48 to 65 years of age, where if you're not really sure, we can try and figure this out. Or if you are really worried, especially if you're immunocompromised, we can think about whether you need to get a vaccine. However, some immunocompromised people cannot receive this vaccine, so we would have to consult with whoever is taking care of you as a doctor, because some people cannot receive this vaccine.
So I think part of this question was answered, but who do you call to see if you're vaccinated at Tubin City? So for kids, for anyone 18 years and younger, I would call the pediatric clinic, and we can easily look up your vaccination record to make sure the child's received the MMR vaccine. For adults, it's more complicated. Some of the younger adults, we may have records. Some of these older adults, they didn't cross over from the old electronic medical record. So if you happen to have any records at home, but as I mentioned, there's a good chance if you were born and lived in this area that you have the vaccine. If you are extremely concerned and you want to know, we can do a blood test to look for evidence that you had the vaccine. And or worst case scenario, we can just give you another dose of the vaccine. So the best place to do that if you are over age 18 would be the public health clinic. And just a little plug for the public health clinic. So this is a walk-in clinic located in the main hospital between the emergency room and the soup clinic. The walk-in hours are from 8 to 11:30 in the morning, and then from 12:30 to 4 in the afternoon. So you can go there potentially to ask about your measles vaccination, but also to get your COVID and flu vaccines and RSV vaccines if you haven't already. But also to get diabetes screening, STI screening, and other general health screenings.
Someone is asking us if they're 44 years old and they had 2 vaccines long ago when they were a young child, do they need a booster? They do not. Measles immunity is very long lasting. Yay, it's a great vaccine.
One question is, if a 12-month-old baby gets the vaccine, how soon will the vaccine be fully effective? So I think it's within a couple of weeks or so, certainly within a month. But so any baby that's not already had the vaccine, certainly coming to get it as soon as possible. So like most vaccines, the body will respond within a couple of weeks.
And it even offers some protection within the first 48 hours, because it's one of our strategies. If we have a family, way back when we had a family that had measles, you would actually make sure that everyone in the family had been vaccinated, or you would vaccinate then and there. And within 48 hours, they were probably protected. Not fully protected, like in 2 weeks, but they had some protection against getting measles.
one of the questions is maybe similar to the other one. How far back does the vaccination go if you're an older adult? So how much protection potentially does that mean? So as Dr. Hu mentioned, once you've had the vaccines, you are protected for life, so that is good. In terms of how far back our records go that we have in the system,
That's so good.
I don't know the exact answer. I would guess age 30 and younger, roughly, we should have records in our electronic medical record system. The rest are in paper charts, which are still available, but take 2 weeks to obtain. So unfortunately, those are not readily available.
But before we went to electronic medical records, way back when, everybody got a little blue card when their kid got immunized. So you might want to ask your mom and say, Mom, you got my blue card? Because we wrote all that stuff down on those little blue cards. And maybe that's something that when you become an adult, you should say, Mom, can I have my blue card? Because there may be some time in your life that you actually want to know what you got in terms of vaccine.
We're just looking at the chat, see if there's any final questions coming in. If there are other questions, the Public Health Clinic is a very good resource, pediatric clinic for kids. We do still have our public health hotline available, and they can help answer questions or direct you to the right person as well.
And thanks very much for attending. We're glad that people are still interested in some of the public health topics. And now you guys are all experts on measles, and hopefully nobody will get it. Knock on Formica, and encourage people to get vaccinated. It's easy to do, and it can save lives. Thank you.
Thank you all for joining. Have a good evening.